medicine Picricum Acidum in Glycosuria. The purpose of knowledge shared here is only educational and to increase awareness. Please always consult your family doctor before using any medicine. Self-treatment may always be injurious. ग्लाइकोसूरिया अर्थात पेशाब में शुगर आना, डायबिटीज की बीमारी कभी ठीक नहीं होती है ऐसा विश्वास किया जाता है, किंतु यह निराधार तथा भ्रामक है और सत्य नहीं है। यदि आपको ग्लाइकोसूरिया है, पेशाब में शुगर आ रही है, जहां आप पेशाब करते हैं वहां छींटे लग जाते हैं और यहां बताए गए लक्षण आपको हैं, तो आपके लिए पिक्रिक एसिड उपयुक्त दवा है। आइए जानें कि ग्लाइकोसूरिया नामक बीमारी में दवा पिक्रिक एसिड कब उपयोगी है। When to use picric acid in glycosuria? Cortex of brain congested. Urine contains sugar and albumin. Urine dark red of high specific gravity. Great indifference, lack of willpower to do anything. Eyes feel dry as if full of sand. Sight is dim and confused. Saliva white, frothy and stringy. Disgust for food. Very great thirst for cold water. Great sexual desire with emissions. Excessive languor and prostration. It seemed difficult to move the limbs. Feet cold, chilly, cannot get warm, followed by clammy sweat. Chilly all over except head and spine. Throbbing, jerking of muscles with great pains between hips. आइए जानें मेडिसिन पिक्रिक एसिड के कुछ अन्य महत्वपूर्ण लक्षण। The yellow color is imparted to the eyes and skins of patients who take it in the crude, and it not only produces semblance of jaundice, but actually disorganizes the liver if pushed. Buzzing and whistling in ears, sparks whirling round of objects, heaviness of head alternately with sense of emptiness, moderately copious, oily looking, yellowish stool with amelioration or cerebral symptoms, pulse slow, small, very feeble, great weakness compelling to lie down, limbs hardly able to steer themselves, no anxiety, profound calm, vivid coloration of sclerotics and integuments, urine colored blood red, intermittent fever of quotidian type, and anorexia, thirst, often sweat, cancerous tint about skin, tendency to cachexia, fatigue, mental and bodily, symptoms worse by least exertion, fatigue going into actual paralysis, brain fatigue, nerve fatigue, at the same time absence of anxiety, indifference, jaundice, cachexia and cancerous tints, tired out, washed out, feeling must give in, heaviness in the occiput, inability to exert the mind, talk or think, and general played out feeling. A stenographer and typewriter, after using her right index finger continuously for 6 years, noticed weakness of her thumb and index and inability to hold pen or pencil. Next, there was difficulty in striking correctly the keys of the typewriter and some wrist drop. The finger was quite rigid and straight, showing extreme spasticity. Girls and young women who, under the strain of many studies, show signs of breaking down, lose appetite, sleep lightly and lie awake, exhaustion after the day's studies, fatigue even from a short walk, twitchings of muscles when asleep or awake, hysterical state, loss of willpower, constant headache, irregular menses. Picric acid, like clonine, has occipital headaches and bursting headaches. The headache, frontal or occipital, is worse on any attempt to use the mind, and it may extend down the spine. There is also a headache extending from the top of the spine up over the head to the eyes. Pain shot up from the spine into the head. Any attempt to study causes burning along the spine, with great weakness of back and legs, soreness of muscles and joints. Priapism, penis distended almost to bursting, terrible erections, disturbing sleep. When overexcitement of sexual system is associated with spinal affections in either sex, great sexual desire with emissions, amorous fancies, jaundice with itching, small painful furuncles, particularly in the auditory meatus, and erythema and pruritus of abdomen and feet. Burns of first and second degree. The clothing is removed and the burnt surface cleansed with the solution and absorbent cotton. Acute vesicular eczema, diabetes, nervous prostration since the shock of the loss of a child 3 years before, wasting with great appetite, intense thirst and copious urination, especially at night, great perspiration and some jaundice, heart flabby, mitral bruit, dyspnea, emaciation, anemia, exhaustion. Urine contains sugar and some albumin, fig warts and gonorrhea, pernicious anemia. Picric acid is suited to dark complexioned persons with dirty appearance about knuckles from bile pigments, anemic and cachectic persons, worn out persons, overtaxed mentally and bodily. Peculiar sensations are as if sand or sticks in eyes, as if throat would split, as if legs enclosed in elastic stockings, as if chest encircled in a tight band, pricking as from needles in legs, as of a lump back of thyroid cartilage, as if stairs are ground coming up to meet him, as of ants crawling over surface. Nosebleed accompanies heat and congestion of head. Heaviness of head alternates with emptiness. The right upper part of the body is more affected than the left leg more than the right. Touch aggravates pimples. The headache is better by binding head tightly, better by rest lying down, worse by motion, walking, raising head, sitting up, stooping, ascending stairs, worse by study or slightest mental exertion. The throat is better by eating, worse empty swallowing. Turning over, and turning the head aggravates the headache. Worse morning, 5 a.m. nausea. Open air and cold room ameliorates headache. Work in open air causes prostration. Wet weather aggravates pains. Amelioration from cold air and water. Chilliness predominates. Lamp light, strong light, moving eyes aggravates pain in eyes. During and after micturition, burning. Thank you.